Hello, everybody. It's such a pleasure to be with you today. Welcome to webinar number 12 in our series. I'm Diane Buis here at MedTech Innovator, where I'm director of the US program. Welcome to MedTech Innovator Live number 12 in our series of weekly webinars that we do as part of the accelerator program that runs for 4 months. We're getting close to the end as an opportunity for the 104 companies across the 3 cohorts to learn from experts all across the ecosystem. Very specifically, the 61 companies in the 2023 US cohort have an opportunity to ask our panelists questions later. But for those of us joining us on the live stream, MedTech Innovator is the largest accelerator in medical devices and healthcare IT in the world. And it's a downstream accelerator, which means that we're not looking for people with ideas, but people with companies that are up and running, have teams and prototypes and early evidence that the technology works, and then partner them with experts in the industry, strategics and others, to help them bring their product to market as quickly and efficiently and with as much value as possible. And so we're opening these webinars up to the broader ecosystem beyond the cohort. And so for you on the live stream, feel free to drop your questions in the Q&A, and our team will funnel them to me and our panelists. And of course, for the cohort, you know this, you can put your questions in Q&A, and we will get to private Q&A at the end of the public section of this webinar. With that, I am just very glad that we have an excellent panel, and especially a panel of friendly faces that if you're engaged with MedTech Innovator, you will over time get to meet these folks. It's a real privilege to be talking about branding and marketing with Laura Nobles, Tom Salemi, and Brandon Morris. And instead of me reading their bios, I will give them an opportunity to speak about themselves, their work, and their relationship to MedTech Innovator. With that, welcome. I'll hand it to you over first, Laura.
Hi, everybody. My name is Laura Nobles. I'm the CEO of Pizanga Health Communications. We are a full-service marketing and PR firm focused in healthcare. Our services run the gamut. The things I like to say about our services, just to make it easy, is we basically provide all communications disciplines aside from investor relations. So depending on what a client's needs are, we can be an outsourced marketing department, or we can be, a partner, working on a particular program, but we've got full service. We are about 17 years old. I can't even believe that, but it's been a really fun ride. I've got a really fantastic team of people across the country, some of whom you might have met at recent events. Certainly, you'll meet some of our team at the MedTech meeting next month. But I am a communications expert. I've been in the field for a long time. I'm not going to tell you how long. But the last 22 years in healthcare, and I landed in healthcare kind of by accident, and I'm so grateful that I did. I was at a tech agency when the dot-com bubble burst, and I ended up moving to a healthcare agency where we worked on everything except pharma. So I got my introduction to healthcare, just fell in love with the whole complexity of the market, just the personal nature of healthcare. I love technology, and so I kind of just made my fit in medtech, really enjoyed this industry. I love being part of MedTech Innovator. I've known Paul and Catherine for a very long time. My company's been part of the ecosystem. This is our 2nd year now, and it's been really fun to work with the cohort companies, 2 of whom are our clients this year. I was really psyched to see some of our clients make it into the program. So happy to be here, to be a resource to all of you, and look forward to the conversation today.
Thanks for being a great partner. And that's a perfect tee up to hand it over to another partner. Tom, would you tell us a little bit? Your background already gives it away, but would you tell us a little bit about what you do?
Sure, happy to. So I'm Tom Salemi. I'm editorial director of Device Talks. We put on events in Boston and on the West Coast. So it means I'm a shameless promoter, which is why I have the backdrop behind me. Device Talks West is coming up October 18th and 19th at the Santa Clara Convention Center. So register now. I don't know how to do that. I didn't go. I didn't go to meteorology school. So Device Talks is an effort to really unite creators of medical devices, from engineering folks to manufacturers to folks managing regulatory and quality and even sales. We also are big fans, and I'm a big fan of startups and VCs, and I'll get into that why in a moment. But we're fortunate to work with MedTech Innovator on our Device Talks Boston program. They are a big part of what we do there. And I really enjoy, again, engaging the startup ecosystem. So we have our events, we do podcasts, we'll be rolling out videos, video podcast series. We'll be interviewing folks from different organizations. I won't share too much, but go to devicetalks.com. You can find our whole portfolio there. We can help you tell your story if it's something you'd like to do. We're working with larger companies like Stryker, Medtronic, and Abbott as well to help them tell theirs. So we really created that digital element to it during the pandemic when we couldn't have our in-person meetings, forced us like everyone else to pivot. So we now have podcasts and webinars like this one. I usually run the webinar. I'm usually in Diane's square, but I'm in a different square now, which is kind of cool. My background is I've been covering devices for 25 years. Similar to Laura, I kind of found my way by accident. I was doing community journalism, was tired of night meetings and fires, wanted to get into something a little more respectable. So took a job at the Boston Business Journal, and the only beat open was healthcare, which included hospitals, biotechs, medical devices, like the whole gamut of healthcare. And it was there where I really connected with MedTech and went on from there to edit venture capital newsletters, which was how I met Paul Grand of the MedTech Innovator. He and I started talking, and ultimately went to work for InVivo and startup magazines, did some B2B magazines until about 10 years ago when I kind of shifted gears into running events and hosting podcasts. So I've started 10 podcasts. I did the math recently, 10 healthcare oriented podcasts, all of which still exist, which I kind of was surprised by myself, but they've gone on to either with the original co-host that I've worked with, or they've been brought, a new co-host has been brought in, and the podcast still lives. So I'm really happy to have contributed to the medtech industry in that way. I've said this at Device Talks Boston. I never go through a day where I wonder why I'm doing what I'm doing. Like, there's never a point where, like, what is this about? Like, what there are people who cover stocks and restaurants and what, and I could see myself growing immensely bored with that. Never once in medtech. So I'm grateful to everyone out there who is actually doing the work of creating medical devices and creating these great stories for us to tell. And would love to meet you someday at a Device Talks meeting, or hopefully we'll have you on a podcast sometime. So.
Fantastic. And there's no greater pleasure than to have one of our own. And I will admit one of our most recent hires that we're very pleased with. And that's why I wanted to make sure I bring him into this conversation. Brandon, tell us a little bit more about yourself.
Certainly. Thank you, and welcome to our attendees. Brandon Morris, the new Senior Director of Marketing for MedTech Innovator. Been here for about 2 months, and the time has flown by, but it's been fantastic. I'm looking forward to what we're going to do in the future as well. I think, like my co-panelists, a couple of common threads are I too have been doing MedTech type work for about 20 years now, and I also kind of came into it a little bit by accident. I've been a lifelong marketer. I've always been a storyteller. My mother would tell you probably that I'm really good at telling stories, and some of them were even true as a child, but that certainly fueled my passion looking at a career. I've done a lot of agency type work and done some high tech industry work. But it was when my mother got sick, and I started in the early 2000s, Googling her symptoms and wanting to learn more about the procedure she was going through. I learned that my hometown area of Boston, Massachusetts, has a tremendous life science ecosystem. And that seemed like a great place to kind of fuse some of my career and personal passions. Much like others here, I'm very much into the idea of fusing the rational side of our stories, the great science, the technology, the clinical validity and evidence, with the personal side of it, that we're affecting human life, we're improving the human condition, we're helping to get treatments into doctors' hands that help heal patients. And I've always enjoyed telling stories and helping to create brands and launch products and communicate with clinicians and patients. and the world about these great kind of advancements and why they're so good. So I think much like Tom, I never question what I do because it's just really great work all around. And so very happy to be here and to be part of this conversation.
I so appreciate all three of you being here today. Your combined experience is is a wonderful boon to our audience. And I will say, if you're watching this on YouTube, I sure hope that you also look at the video competition that is currently ongoing for the MedTech Innovator cohort. If we're going to talk about storytelling and about great storytelling in MedTech startups, that's an example, and you can see how it's done. But to jump into the discussion, perhaps first, storytelling, marketing, and branding, you have to think about who's listening to the story. You have to think about the objective, the target audiences. And so for startups, for it's pretty much always investors, but not to forget other audiences. So recruiting talent, customers, you're trying to sell something. Sometimes it can go for clinical trial, patient outreach, or even eventually to affect change, be that patient advocacy, be that policy changes. So that alone is some very different constituents. Can one craft a unified message? Is it even possible to have one message for all of these audiences? And if not, how do we prioritize? And because I ended with you, Brandon, I'll go to you first. Is there a way to craft a unified message, and how do we prioritize?
There is, I think, and when I think about these things, I think of them in terms of what I call a layered messaging platform. And it really starts with a mission. I think the mission of an organization really is the one universal thing that no matter what kind of audience member you are, and I'm glad you mentioned the different kinds of audiences because that's critically important. But if everybody, no matter the role they play in this, is unified around a mission, I think that's the first step to really defining your messaging. The second part I kind of layer there when you build on the foundation of the mission is the value proposition. And those might be aligned a little bit differently to the different kinds of roles. And then the messaging layer probably sits on top of that. And that's both the words, the images, the concepts, the emotions, the information that you want to communicate about that value proposition to an individual type of audience member. And it's also how you do it, making sure you're reaching them in the ways where they are most receptive to receiving your message in the way you deliver it. So when I think about prioritization, I go back to that idea of the audiences, and I'll talk a bit about this concept called personas in a minute. So I'm going to think of different personas. And I think about really first, who's my primary target? And that's going to be based upon perhaps where we are in our kind of company organization growth journey. It may start off being investors, it may start off being suppliers and partners. I think probably one of the primary targets you're always going to deal with is going to be, and this is a bit of a catch-all term, the prescriber, who is actually going to make the decision to use this type of med tech for patient care. Probably secondary to that might be a payer, if we're talking about a reimbursable type of technology or procedure. Maybe it's patients if you're going into the direct DTC route. Surrounding that prime, and this will, you don't need to figure this out based upon kind of who you are and where you are and what the product is. I then look at my secondary targets, and these are the influencers of who helped make the decision of getting that treatment into the marketplace. That could be payers, that could be patients, that could be other allied health professionals who work, nurses, caregivers, administrators, folks like that. It may also be key opinion leaders, the clinicians and scientists you might use to help add the authenticity and the viability to the message you're delivering. And then maybe there's some tertiary targets that I might prioritize. And those are maybe people in my metaverse, my partners, my vendors. That could certainly include career seekers and talent, people who are trying to attract our organization. And the fourth one I'll add, which probably crosses some of these, and I think is really important and might get overlooked when you think about this straight from a commercial point of view. But if I'm thinking long-term about how do we create an organization that is going to last, that's going to persist, that's going to win, the internal audience, your current employees and members of your internal ecosystem, I think, is critical. I can remember at a previous company where we're running some laboratory tests, diagnostic tests, and we had some culture challenges in our laboratory. A lot of burnout, a lot of turnover, a lot of disgruntledness. And over time, as we were able to kind of shift the mindset of the laboratories professionals to be thinking of their jobs less about, I'm just running 96 well plates through a PCR machine for 8 hours a day, to, hey, I'm doing something that's helping a doctor get information upon which better care will be made. Getting that kind of employee buy-in to the mission, I think, is critical. And then that just makes for a much better organization, both professionally and personally going forward. So I think once you've kind of thought about who are my layers of personas that we need to deal with, you then want to develop them a little bit. And there are a number of different ways to do this. The model I've found to be really helpful in a lot of the work I've done is you almost create little avatars for them, create them to be as much like real people as you can. So there may be some quantitative work that's done here. Maybe if you've done some market sizing, you kind of know X number of professionals exist in the world who I might need to seek here, who might be relevant to my product. But it's also largely qualitative, and it gets kind of knowing these folks at a very personal level. So for each one of these roles, I might create a real archetype for each one. I'm going to want to know what are their needs, or what drives them personally and professionally. What are their pain points and their challenges, the things they're trying to solve, the things that impede them from trying to solve those problems. I'm really going to want to understand how and when they consume information. For example, are these people who can generally go to a conference, or do they never go to a conference and they're getting all their education and learning in a time-shifted kind of format? And then for each one of these, I really create an avatar. I give them a name. I give them a picture. I give them a little bit of personality. I try to figure out if there's some common demographics, primarily in terms of maybe of like their educational level. Do they have terminal degrees? Those sorts of things. And we create these little one-page sheets, and I'm happy to share those with folks if you want to get one after. But when you think about your audience in a very personable and human and relatable kind of a way, when you can approach them and understand them, much like we understand each other, then it becomes easy to start figuring out how does the messaging apply to them? What do they need to hear? What kind of proof do they need? How do we deliver it to them in a way that they're receptive? And what do they need to know next? And I think if you can do those kinds of things, you can have a unified message. You can have it based upon that common value with perhaps some discrete value propositions. And where you get into the specifics of those different roles is perhaps the delivery of the message, the how, the why, and the when, if not the what.
I appreciate that. Brandon, you're going to be inundated with people. Be careful what you wish for. Brandon gave us a pretty broad answer, and so it's quite possible that you don't want to add something to it, but I want to give you a chance to add to it, Laura, and perhaps then Tom. But you get to say pass. We got plenty of other things to talk about.
I think it's an important question. I agree with what Brandon has talked about, but what I would say is that not only is it possible to have one narrative, it's essential at the top, because you have to have a story that exists above each persona, I guess, if you will, of the main narrative of what's the unmet need that you're filling, how are you doing it, why should I care, in general, right? But I agree completely that, the value propositions for the different audiences are going to be different. So when we come up with narrative and messaging for clients, it's exactly that. It's what's the overarching story, and then what are the messages by audience. And I think in addition to sort of creating these personas, one of the things that we really find helpful when working with clients is to interview said people. So talking to KOLs, talking to people who are outside of the company, who can represent a patient who's been touched with the technology, a KOL, on and on. Just to make sure that we're hearing from them. We're not creating something in an ivory tower. We're actually hearing, okay, what is the market telling us about? How are they perceiving this company? How are they perceiving the product? How are they looking at the unmet need? So I think all of that's really important, but I think it is really critical to make sure that you do all sing from the same song sheet at the very top, because we get inundated with so much content as US adults. You have to say the same thing over and over again for somebody to remember it. And so having that, consistency is really important.
No, if I may, I think those are both great points. I love the persona idea. I think Laura's presentation is right. Exactly, having an overriding story. I think what I would only add to that would be, don't discount your own personal story. I think startup people are amazing. I mean, you quit your job, you were offered 6 figures or whatever, and you said, no, I want to do this. You had a choice between doing the safe thing and doing the unsafe thing, and you chose the unsafe thing. 90% of the people choose the safe thing. And I think it's important to explore why you chose the unsafe thing. And it goes beyond, this is a big market or this is a cool technology. There's something more there. So as you're preparing yourself in developing the story, do everything that they're talking about for your company, but take some time to look inward too. I did an interview with Anton Clifford at Moxamed recently, and he opened up, before I push record, he's like, oh, I'm really boring. Let's just talk about the company. He was not boring. I mean, he was not boring. Like his story was great. He packed up his family from Ireland and moved to California, and it's led to the creation of this great company. I'm like, you can't discount your own personal story. So startups are more than just technology and market sizes. They're the people who start them. So please look inward as well and be prepared to answer those questions.
That speaks a lot to that human connection and memorability, all of that. I think one of the things you're teeing up in that context is actually branding. We talk about personal branding, and that's something that the personal story brings out. Then, of course, we're talking about company branding, and I know that that's a question that Laura gets a lot. And so, I'm going to come back to you and say, when is it too early or too late to think about branding? And I sometimes get asked, is that even relevant for a medical device? Like, does the end user, does the person the patient actually care about brand? So I know that's more than one question, but let's start with, when is it too early or too late to start thinking about branding?
I don't think it's really ever too early from the standpoint of coming up with who you are, why you exist, what difference you're going to make, because people have to know who you are to be able to buy into your technology. So you really have to start thinking about that early. You may not execute a full communication campaign early on, but I think it's very important to start thinking about that. And I was talking about this yesterday. We did a similar webinar with your Asia Pacific cohort, that one of the things I love about MedTech Innovator, and I love a lot of things about it, is your value program, the value creation program. So people on the phone are probably familiar with this, but that's such a critical tool. I mean, I think in so many ways, but it really is great for marketing and branding because it's your story on a piece of paper. And that just is incredibly helpful. One of the things that, is not new is there's a lot of sameness of language in healthcare, in every industry, really. And so you really have to be disciplined to make sure that your story, as differentiated as possible, as compelling as possible, succinct. And so I think that process that you're going through to develop that value story is really important. I think, one of the bigger mistakes, we had a question last night about how long should you stay in stealth mode if you stay in stealth mode? And you really have to think about that, because you don't want to be staying in stealth mode, not doing anything about your brand, and then all of a sudden you've got an FDA clearance and no one knows who you are. And we're trying to tell your story, and it's just I don't know how many pitches, Tom, you get a day. It's got to be a lot. But thinking about how you're going to position yourself before you get those big milestones is important. And I would say also, to your question about the patients, it really depends, and who the audience is really depends on what technology you have, because sometimes you do have a technology where the patient does know about it and it's impactful in their care, or maybe your technology is way upstream and it helps the physician, but the patient's not going to care. So it depends on who your audiences really are based on what you're offering.
I had a very minor procedure recently where I just out of curiosity asked the physician, what brand are you using? And he just looked at me. It's like, why do you have a favorite? I'm like, no, I'm just kind of curious. Like, it doesn't really matter what you use, but I was just curious. So you're right. The patrons aren't going to care very much. As far as the branding for a company, I mean, I do think that I honestly think the name is important when getting people to cover it and take it seriously. I mean, I think you want to be, then there's no, I feel like the restaurant reviewer here who like, I don't know, I just didn't like it. Like, it was technically everything was great, but I didn't like it. Give some thought to your name. Try not to be too cute. Don't throw too many numbers in there. Don't make it hard for reporters to spell. Don't intercapitalize. Don't start with a lowercase. All that stuff that's just going to like lead to follow-up calls and frustrations. Just be, and this sounds like I'm complaining, and I kind of am, but just be cute, be catchy, but not cute. Like, don't go too crazy. But I think branding and I think it's certainly, and I have never started a company, but I think having a company name and a brand and an identity is great for everyone, because there's just an understanding and a stability there where when you think of that entity, even if it's a small company with 2 or 3 people, you know what you're getting. It's not just something that's amorphous and could be different every day. So that's the restaurant reviewer's perspective of this question.
Brandon, I might broaden this question as I put it to you, to what's in a name. And so I think we've already talked about branding a bit. Sometimes folks realize my name is not working for me, right? They might be doing some of the things that Tom just told us not to do, and then a name change is warranted. You get to obviously comment on branding, but perhaps take us towards names. What's in a name? When do we change a name?
Certainly, and I to kind of go back to the previous question a little bit. I'd agree with Laura that earlier is better, both from in terms of setting up the communication part of the process, but I'd also think about that in terms of like your IP strategy. At the same time, you're going after patent protection for whatever technology you're developing. Think about the trademark protection as well. You're putting all this effort into creating a brand, and when I think about brand, I think about the idea of a brand as a promise. It's something that a company is promising to the customer. And it's the customer who decides if the promise has been delivered or not, right? That's the perception of the brand is really in their hands. So yeah, I agree with everything Tom said as well. I think when you do this, you want to do it right the first time, right? There are good reasons to change a name at some point in the process. There are horrible reasons to change a name sometime in the process, but the goal should be to get it right early and to never be in a position where that has to happen. When I thought about products I've named before, this is probably one of the hardest things to do. Maybe coming up with a 40-character subject line for an email might be the hardest thing a marketer has to do, because it's very short and you have to communicate so much in there. And naming is the same kind of a thing. The cute or the catchy but not cute, the easy to spell, easy to recall name that Tom mentioned has to do a lot of things in a very short period of time with very little real estate. It's going to communicate the value of what you're bringing to market. It's going to differentiate that value you're bringing versus what the competition is bringing. As Tom said, it's going to be easy to recall, easy to spell, easy to type. Think about typing into the search bar in a web browser. Can you trademark it? Will it pass the trademark search in the countries you're trying to get protection in? Will it work across cultures and countries? There are all kinds of great examples from the past of names that were used in one country, and it turns out it means something horrible in another language. And that can affect if you're thinking about going beyond the borders of where you're going for your first clearance. The other thing I'd really think about these days, especially where websites and social are such a critical part of a marketing strategy, is the URL available for that? Can you get a social handle on all the major platforms? Ideally the same one that represents the name as well. I would weigh those kind of factors into consideration between 2 good names. Which one will be easier for someone to find and for me to use in the digital space? If you think about the amount of time and effort and frankly cost it takes to build a brand, to get the kind of name recognition and recall that we're all looking for, it's exponentially harder and longer and more expensive to change a name the further it gets away out of the gate. I can think about some reasonable but unfortunately tragic things that would require you to change a name. Maybe there's a field action or a recall. Maybe there is evidence of poor device performance. Maybe there's some marketplace confusion or lack of traction, all those kind of things. And it's just a horrible thing to do. I've thankfully never had to do it, but I've thought about what it would take to do that. And I've blanched every time, because I'd much rather put my time and effort and resources into building the brand rather than trying to claw something back and put something back out there in the marketplace. So I think the best approach to do it is to get it right the first time as best you can. And then at each step, if you come across a challenge, this is a tool in your back pocket to do a name change, but it probably should be the last thing you consider. There's probably many other things you could do to help repair or uplift or infuse a brand with better validity, with using paid promotion to overcome some of the recall issues, being consistent and being regular to help establish that kind of traction you're looking for. But the name change really should be the last result. Try to get it right first.
Good advice. Try to get it right first. I'm on board with that. Laura, I'm sure that's a question that comes to you often as well. So I want to give you a chance to weigh in on names and changing names.
Yeah, thank you. This came up actually on our webinar with Asia Pacific as well. And one of the things I would add to what Brandon said, and I agree with everything he said, is try not to come up with a name that you have to explain. Yeah. Because then you're just going to go down a rabbit hole. And I used an example last night, which I'll use again today. It's pretty funny. There was a client of ours years ago that had a light adjustable lens for cataract surgery. And the name of the company was Calhoun Vision. And I asked the CEO, why Calhoun Vision? And wait for it. The founder of the company lived on Calhoun Street. They've subsequently changed their name. But, I think, a lot of us that live in the startup world, sometimes sometimes it's going to be a very engineering focused company. And maybe you grew up in a lab and you've got a fun name that has something to do with, a nickname in a lab or something, or, a code name or something like that. And I think, just be conscious of the fact that the name is very important. It is hard to try to find names, but I think, trying not to be too cute, like you said, Tom, and not having something that you have to over explain.
And I would just say, once you've settled on 2 or 3, give them to people who are not in the industry and have them read it aloud. Mm-hmm. And see what they come up with, because I've said things like, oh, the name of the company is this, and they just look, and the person has looked at me sideways like, no, it's absolutely something different. And once they explained it, to Laura's point, it was fine, but to my eyes, like, that's not what it says. It's like, and you shouldn't have to get to that point. So yeah, have some civilians take a look at it.
Mm-hmm.
And a couple of approaches you can go to, like there's a very literal type of name that very clearly communicates a value. There are some that are a little more aspirational that maybe hint towards the intended benefit of the therapy or the technology. Some things in between, but absolutely agreed. If it focuses on a name or a concept or an inside joke or something that won't actually tell the civilian, as Tom noted, what benefit will this bring? What value does it bring? How will this help a patient? How will this make the delivery of healthcare easier? If it's not doing one of those things, that would go to the bottom of my list, and I'd really look for things that do clearly communicate that value. Make it easy for someone to understand at least what is the therapeutic area, what is the disease state being addressed, what is the perceived benefit someone might get. If you can hint towards those things, I think that improves the recall as well.
Absolutely. So I'd like to talk a little bit about marketing strategies, right? We all of the companies are thinking often many years ahead, but have to start now. So I'd like to talk a little bit about key components of a successful marketing and sales plan for now, and then for the future. How do communication strategies change over time? And I'm open to having any of you jump into it, but let's start with key components of a successful marketing and sales plan. I'm happy to have any of you jump in.
So I can give a couple of thoughts around some things I've found helpful. So I'm going to kind of go back to this idea of the personas. And I think getting that first step done is, for me, in the work I've done, has been really critical, because this affects not only the kind of information, the types of information I'm going to want someone to know, but also how I deliver it. And when you think about a plan, which is usually calendarized somehow, there's a sequence to it, there's an order of operations to it. The delivery is as important as the actual message itself. And I think the thing here I've kind of learned, sometimes the hard way, is that even among roles that I can kind of assume to be very similar, could have very different sorts of ways in how they consume information. A clinician will probably consume information in different ways than an investor. And even within clinicians, and even within specialties, people consume information differently. I worked at a company recently that had a nephrology-based product, and two of our key audience members were transplant surgeons, who perform transplant surgeries, obviously, and then a community-based nephrologist who was a specialist in kidney disease, but not transplantation. And what we found was that both of them really wanted education, but they consumed it in different ways. The transplant surgeon had the leave to go to conferences, and they were primarily a conference-based, in-person-based, networking-based kind of educational consumer. And your community nephrologist, who just didn't have the schedule or the funding, perhaps, to go traveling to conferences, they were very much consumers of information through journals and through time-shifted webinars. They wouldn't watch one at 12 o'clock on a weekday like we're doing today, but they would watch the replay at 11 o'clock at night, 6 o'clock in the morning, in 15-minute segments during the day. So just really understanding how people consume things, I think, really influences how you deliver your messaging. A couple of the things that I've found helpful are the audiences that I tend to work with tend to be very data-driven. They want proof, they want evidence, they want data. They like publications, they love peer-to-peer education, but they're also human. And so we got to kind of balance this idea of a rational argument versus an emotional one. And there was an HBU study several years ago, but I think still probably pretty effective, around the idea of if you can communicate messaging that speaks to both the stereotypical sides of the brain, the right and the left, the emotional and the rational, stories stick better. And so I always kind of want to work in some kind of a human element, a care element, a compassion element into even a rational type of argument. I think about the stages a consumer goes through, and we all do this in our own lives, whether we realize it or not. In fact, next time you make a big purchase, think about if you go through these yourself. There's the idea of awareness. Am I even aware of this potential solution to the problem I have? Moving into interest, is there something about this particular solution that's compelling to me, either on a feature or benefit or a price or an availability type of function? There are some elements of consideration. What is the competition? And sometimes the competition includes doing nothing or doing what I've always done. There's usually a purchase stage when it gets you over the point of actually committing dollars to the solution you want to acquire. Then it goes into retention. How do we keep you as a customer? And the best stage gets to that evangelism stage, where somebody is so happy with a product, they're going to speak about it and tell others of their own accord, unprompted, that they should do this too. And so if you think about the purchasers of medical technology going through those stages, what does my marketing plan do to help move people through that? Different kinds of content, different types of messaging might help get someone through those kinds of things. Awareness really might be all about branding, about someone recognizing the name and the value through it being put consistently in the marketplace. Consideration might mean that we need to provide proof, a bit of a competitive analysis of our products' features are X, Y, and Z versus the competitive products A, B, and C. And that brings additional value that they can't offer. So think about those stages and what does each person need to know to move through them, ideally as quickly as possible, right? And then I think the last thing that really comes to mind for me is, in addition to things like the digital world being so important, social media and websites and email being an incredible way people learn, and being relevant and consistent and regular in how you communicate those things. I think there's often an overlooked tool that sometimes people don't use. And in the early stage, this may not be possible to focus, but as your organization matures, I think, especially in medical technology, there's a great role for the power of advocacy and philanthropy. The idea that, and this helps with the brand, this helps promote your values, helps demonstrate the value you bring. But if your organization can think about the therapeutic area you're trying to address, and how can you be a genuine, authentic partner in kind of lifting, the rising tide for all boats, I guess, for the cliche. Can you put your voice and your effort and your power behind patient and clinician advocacy and philanthropy for that particular therapeutic area? That is a great way to give back and a great way to help extend the reach of what you're doing beyond just the technology, but towards being a good partner and all those kinds of things.
If I may, I think that's a great point. And I'm thinking of we'll be having, and this isn't a promotion for the conference, we'll have Imperative Care at the conference, talking about how they started off as a neurovascular company, have vascular tubes now, but they also began looking at people who have recovered or been treated for strokes and how their lives exist after that. And they saw a huge gap in those folks. So they're actually have built a digital health company that they recently spun off to help those folks and help their caretakers. And they're looking at the whole continuum of folks who have been affected by strokes. And Brendan, I think it's a great point. I mean, I'm not saying everyone's going to do that, but I think if you broaden your vision to the life, to the universe before your device is necessary, and to the world after that, it's only going to inform your own story. It's going to broaden your story, and it probably will lead to opportunities that you never knew existed. And I think you'll touch more people that way. They'll come to know your story that way. So I think that's a very authentic way of showing you're more than just a company that's making a cool piece of technology. You're actually an entity out there that's looking to improve people's lives. And I think that's a selling story. So.
Yeah, I can also talk about advocacy. I think if you look at the US market, cancer, Alzheimer's, some of these big disease states have significant advocacy elements to them. And I think, not everyone on this call is going to, have a therapeutic or a product that's going to fit into an advocacy box. But when that makes sense in terms of educating patients on what you have, if it's something new, on helping affect policy, definitely in the area of, say, breast cancer, for example, we have a client, Delphinus Medical Technologies, that has a imaging device specifically put through a PMA study and approved by the FDA for women specifically with dense breasts, which includes 40% of women. And cancer hides on mammography in dense breasts. And a lot of people don't even know this. And there's been a lot of effort on a national level now where women are supposed to get letters after they have their mammogram saying you have dense breasts. The challenge is that there's no great standard of what happens next. And the Preventative Task Force came out with some updates last year on mammography and other things and didn't really touch dense breasts. So it's like, it's really up to the patient in a lot of ways to advocate for yourself for additional screening. So there's actually a lot of advocacy groups around dense breasts. The first one that was started that I know of was started by a woman who had a clean mammogram and then a couple weeks later had like really advanced cancer because it wasn't found on mammogram. So that was called Are You Dense? There's dense breast info. So, it depends what space you're in, but I think there's certainly a huge role that advocacy can play. And I think that, it's being in the community that you serve is really important in terms of, showing your authenticity, that you're not just trying to sell a device so you can make a buck, that you're trying to solve a problem. But I would go back in terms of sales and marketing plans. And again, it's kind of hard to paint a broad brush without knowing a company's specific technology, but some of the tried and true things that we've done for years, I also still advocate in terms of aligning yourself with key opinion leaders early on, in terms of letting them know about your technology, aligning with luminaries who can sort of tell your story for you and share within the community that you've got something new. I think that's still really important. And then making, celebrating your successes with your customers. And, and the other piece that's really important, and we brought it up, and this is not necessarily the marketing function, but you need to feed marketing with good content. That means clinical data. That means economic data. That means, great case reports, patient stories, things like that, that help you tell your story. So in addition to everything that everyone else has said, I just wanted to kind of highlight those few things as well.
Absolutely agreed. Absolutely agreed. Yeah, I've in organizations where I've had like a direct field sales force, embedding the marketing function in sales, so you're going on rides, you're getting that information back in, has been critical, absolutely critical.
That tees up the what do you do in-house and what do you outsource? I think a critical question that every startup has to ask themselves, and that goes for just about any size company. You can even tell from this conversation, we've got Brandon in-house, and we've got partners and friends like at MedTech Innovator, right? We've got partners and friends like Laura and Tom. And so it shows you even how we ourselves manage our brand and our marketing and PR. And so I'd love to put it to all of you. Maybe I'll ask Tom first. Tom, you are 100% in the business of getting messages out. What has been your approach, and what is your advice on what to do in-house and what to outsource? And then I'll post it to the other two.
Yeah, I think I won't take a lot of time with this one, because I can't imagine creating content, creating messaging effectively is such a unique skill set that isn't necessarily found within the halls of a startup where they're focused very much on technology and developing tools. So I completely see the wisdom in bringing an expert in from the outside to help you craft that message. I guess my advice to folks would be, and I don't know anything about how this process works. I've never been involved in these discussions, but I would love to, if I were starting a company, I would interview multiple firms. I would get to know the people who are actually going to be handling my account and reaching out to reporters. I wouldn't just talk to a senior person and then have it farmed off to someone else, because, and this is a bit off topic, that associate who's reaching out to the reporter, that's your first point of contact. That's the first impression that you're getting. Make sure that's a good first impression. Make sure that it somehow find a way to make sure that first email that goes out sounds intelligent. I received your point earlier. I'm not buried in pitches like my colleagues at Mass Device, but I get enough per day. And very often it's, here's a company you should write about for your publication. Well, that's great. I don't have a publication. I put on conferences like strike one. It's like, do the basic research, like send an email to that person, but not that person. That company that paid for that person to send an email just got a ding against them. Obviously, one that's easy to overcome once I get to know them. I'm not going to, but it's just like, and then that person just keeps following up on it. And I'm rambling now. I'm at a point where I also don't know what's AI generated and what's an actual person. So my standard operating procedure is to ignore the first one, and maybe even the second one, when they say, just checking up on this. And then the third one comes in, and finally I say, no, thank you. So know who you're dealing with if you're going to outsource. That's my advice. I think that's critical, and know who's representing you. And I also would just do keep in mind, though, like you can outsource everything in terms of the strategy and the creating materials, but never take your eye off looking inward, as I said at the start, and thinking what the salient points of your story are, because someone coming from the outside doesn't know the area like you do. And if you come and just ask them to kind of observe and then come up with their stories, it would be impossible for them to hit the mark the first time. So keep a creative eye on your own life, on your own market. Understand what the challenges are, and really work with them. Don't just say, here, handle this. Like, really work with them and help them understand your story a bit better. So that's my advice. Inside or outside, I think that's a very personal decision, and I think my fellow panelists would have better insights on that than me.
Laura, you're often the outside entity that one would call. I sure would call you, and I have.
Yeah.
Tell me a little bit more.
Absolutely. I think that, at the startup stage, there are so many things that you're working on execution wise that, in my experience, a marketing hire isn't the first, hire to come in. So, it does make sense to outsource things. And just the other piece that I think is valuable bringing in a partner is somebody that can look at you from the outside, and give you some perspective. And I love, Tom, your vignette about the junior person contacting you, because that was me like 30 years ago. That's how you all grow up in PR, right? But shameless plug here, our firm is all senior, because we don't do that anymore. I love mentoring my people, but I did that a long time ago. And, we don't want that, that our clients to have a ding where the journalist is saying, what the heck is this? You don't even read you don't listen to my podcast. You don't read my stuff. You don't even know what I do. All of us get emails, right? I think I got an email 3 times from somebody who was telling me as an e-commerce platform that I should be doing this, this, and this. And I'm like, have you even looked at my website?
Yeah, right.
Moron. But anyway, I think that, that it's important, as you said, to vet the partner and feel like you can trust them to basically carry the torch for your brand, because that's what we're doing. And I think I mentioned this before we got on the call, but I truly believe that from a PR standpoint, we not only serve our clients, the companies that work with us, but we serve the journalists as well. We're not here shamelessly trying to just get ink for ink's sake. Tom and his colleagues have a job to do. They want viewers, they want traction, and so it's our job to give them content of value. And sometimes that's counseling your client, this isn't really up to snuff. This is not going to entice. This is not going to be very newsworthy or whatever. I think it's important to understand that we have a job to do. And just like they're trying to sell to a doctor, we're trying to sell to a journalist of saying, hey, what do you think of this story? And so it's important to look at it from that standpoint as well.
That's really
Think
helpful.
about the organizations that are the partners I've looked to do at various levels of marketing teams, and I've worked for very large companies with massive internal teams and very small companies where I was the team, at least at first. The couple of things I consider when thinking about looking external partner probably include things like, is this a real specific skill set that requires dedication to learn and stay current with that I just can't do? And something comes to mind. There is something like search engine optimization, which seems to change. The nuances change on almost a weekly basis. Google and Microsoft don't tell you what they're changing, so it requires a lot of trial and error. There's a lot of technology and technical tools that go into this, a lot of research that goes into this, and a lot you can learn kind of cross-functionally across different types of organizations. So I'm never going to develop that competency myself. I have too many other things to worry about. So I'd go and hire someone to help me with my SEO. Something like Laura's firm, the PR space, where again, there's a very specific skill set. There are relationships there. There's I'll call them traditions, for lack of a better term. There are ways of doing things in that space that those folks seem to know that are successful. I'm going to trust a well-vetted partner to do those kind of things for me, because again, that's not a skill set I can develop quickly. And then I think about organizations like Tom's, where they've curated this great audience that I want to reach, frankly, and I'm going to tap into their this incredible thing they've created to help share my message. So when I'm looking for people who have built things that already exist, that are relevant to me, that I couldn't build on my own or would take way too long to build on my own, those are the kind of things I might look to do some outsourcing on. If I think about strict creative storytelling, that gets a little more of a gray area, because it is possible perhaps to have the strategy and the tactical execution of those be in-house maybe a little more easily. I think everybody in the leadership of a company, especially in the sales and marketing function, should be able to give the 30-second elevator pitch, to talk about the mission, the vision, the values, the unique selling proposition, all those kinds of things. That should be a part of our daily vocabulary. And those are the things that we're going to own and we're going to continually refine, and we can share those with a partner. But it's probably rare in my experience that the partner will ever be just quite as good as we are. They'll get real close, but maybe not speak to it with the same level of authenticity that we can. So it's easy to maybe get your visual people and your writing people, your vocal people to be in-house, because then they're immersed in the story. They understand the mission and the values that drive it, and they can communicate those on their own or with the support of partners as well. So those are kind of things that when I've mentored teams and grown teams myself, I've probably tended to keep some more of those general communication type skill sets in-house. And then for those very specific applications, whether it's technology-based or skill-based or audience-based, work with great partners on those kinds of things.
Diane, if I may just quickly, if companies are very early stage, be too early for some of the, I guess I would ask people, don't sleep on LinkedIn. I mean, I think creating a good LinkedIn persona, getting yourself out there, liking, commenting, just getting to know people. I'm not saying you have to share your state secrets on there. You can post things about the disease you're targeting. You can just post some thoughts about conferences you've attended, but this is something you can do 15 minutes a day, schedule your posts, and just be out there, and you'll get known, and people will come to know you as a person, and then get to know your company after that. So don't sleep on that.
Could not agree more. Time flies when you're having fun. And the public portion of this webinar is almost at a close. And so I want to make sure that I give our three panelists an opportunity to give any advice, resources that our online audience should know before we bid them goodbye until next week. Anything goes. You've already given plenty of really good advice. But Tom, I expect you to tell us one more time what the dates are for the West. But I'll give Laura the first word.
Yeah, I think, my parting words of advice are really, really make sure you nail your story. That's just critically important, because you can spend all kinds of money on marketing, and if you don't have a good story to tell, it's not worth it. So just be disciplined, try not to be in love with yourself and your technology. Look at the landscape around you, look at what your competitors are saying, try to get out of the sea of sameness, which you'd be amazed to see how much sameness of language there is out there. So that's one of the things I particularly love, is just being really disciplined to peel back that onion to really figure out, okay, what's the real story here? So just, work at your story until it really sings.
Fantastic. Brandon, I'll give you the word, and then we'll close with Tom.
All right. Absolutely agree with everything Laura just said. I would then grow to that to understand you can't do it all immediately. The foundation is that great story. But when you think about kind of your tactics and where you go, you can't do it all on day one, and won't all be right on day one. This is very much a process that grows. It's iterative. There's a lot of test and learn. There's a lot of controlled failure. There's a lot of good learning from the failures along the way. So I guess my advice would be understanding your story, understanding your audiences. Try to do a couple of things. Start them small, analyze them and review them rigorously, iterate and try again, get good at a couple of things, and then expand from there. But just give yourself kind of the grace and space and patience to know that this is, building a brand, launching a product, growing these things takes time and effort and discipline and regularity. And you won't get it right all at once, and that's really okay. It's a journey, not a destination.
Yeah, I'll just add on to that this is an art, not a science. You may have the best piece of news crafted perfectly well by Laura's team, pitched excellently, and for some reason it's a busy news day, something happens and it just doesn't land right on that particular day, or another day you're on the front page or whatever. There's a lot of magic to this. That's not magic. A lot of art and sort of impression of this. Like, as I kind of indicated earlier, it's kind of like finding a favorite restaurant. I mean, sometimes the story just kind of fits perfectly into the slot the journalists have. Sometimes it doesn't. To Brandon's point, don't give up. Like, it just because it didn't work once doesn't mean the next time it's not going to work. Just stay to your story and be consistent. I gave the LinkedIn advice. I won't pitch the conference, but if anyone listening wants to go, reach out to me on LinkedIn and I'll find a way to make that happen. We'd love to see you there at Device Talks West. So That's it.
I sure will be there myself. I very much appreciate all three of you being here today. We'll end the public portion of this webinar. Really appreciate your time. Everybody who's following us on LinkedIn or YouTube, please come back next week. We will be talking about scaling your company and growing your sales team. With that, we'll bid goodbye our online audience.